Hello, 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 and welcome to Medicare One-on-One with Purpose DNA and Health. My name is Sherelle, and I am so happy that you came to join me. I'm not going to be before you guys long. I'm going to try to make this as quick as possible. I know you have things to do. So, as the church say, I won't be before you long. So just wait a few minutes and bear with me. I'm gonna get through this as quickly as possible. Thank you again for coming on. Um, Before we get started, I just want to give you a little background about myself. My name is Sherelle Evans. I am owner, operator, founder of Purpose DNA and Health. I am what you would call a three in one. My slogan is there is purpose in the blood. And I have that slogan because I started this company because my mom had kidney failure. She had kidney failure, and I was her caretaker. At that time, I realized so many different things about my mom and about life and health and a whole bunch of different things. One thing I realized is that I did not know much about her insurance and how much it covered, how it worked, how it didn't work, what it didn't cover. Not only that, her health in general, when it comes to renal failure, I remember I was a phlebotomist for about 15 years, and there were times when I would take her to the doctor and I would have to draw her blood because they couldn't get it. A lot of renal patients have difficult veins. So I was able to help her in that area as well. The DNA comes more of a little personal uh, side, which is why it's called DNA, Purpose DNA and Health. I do DNA testing as well as phlebotomy services at my office too. So that's why I say I'm a three in one, and it's all because of my mom and the experiences that I've been through. So this is more personal for me than just doing it just to work. Like it means a lot to me. It's me remembering my mom every step of the way and being helpful to someone else. So I am located at 715 Pendleton Street. Me and my other colleagues in the office also deal and help with insurance as well. I do other things besides insurance, of course, phlebotomy service and DNA testing as well, but I also do the Medicare side, the health insurance, as well as life insurance. So if you come to our office, you will be able to get assisted with anything is insurance. And of course, I can help you with those other things as well. But we are not talking about that. We're talking about Medicare today. So we are going to get into what Medicare is, how it helps you in the different parts. So Medicare and Social Security work together. The Social Security Administrator determines who is eligible for Social Security benefits and Medicare. They also perform many of the administrative functions for Medicare. Medicare is available for younger people with disabilities, like my mom. She wasn't quite 65 years old when she got kidney failure, but she was able to get Social Security services and Medicare because she had the disability of renal failure. And so that's something to keep in mind. So even if you're not 65, you can still get Medicare to help pay for some of the costs. Social Security and Medicare are also safety programs that people pay into during working years through taxes. So that means the years and years and years that we work goes into our Social Security to help us pay for our Part B Medicare premium. Okay. And this is just a breakdown a little bit about how to determine your premium based on your income level. I'm not going to go into all the details about this, but I will say, depending on if you make less than 103,000 or if you make more than 103,000, around this area, $174 to 244 was the arena of what your premium would be for Part B monthly premiums. But coming up this year, 2026, this premium will go up. Okay. So be mindful of the new changes that are coming out. We'll do another webinar later on to explain to you the different changes come October. So this 174 is going to go up to $206. So be mindful and be aware of that for when you see the deductions come out of your Social Security, which brings me to this part down here. Part B premium can be automatically deducted from your monthly Social Security check, and you can choose to pay the premium out of pocket. So if you get your check and you say, oh my goodness, what is the 206 for? It's that reason. It's not the 174 or the lower amount. It is the 206, which is the premium for your Social Security, your Medicare. All right, Social Security covers original Medicare. So Social Security enrolls you in Medicare Part A hospital insurance. Part A helps pay for inpatient care and hospital or limited time at the skilled nurses facility following a hospital stay. Part A also pays for some home health care and hospice care. For those who have worked 40 quarter hours, and you may purchase Part A in 2025. That just So let me reframe that so it can make sense. If you've worked over 40, if you've worked over 40 quarter hours and or 10 years, that depends on the last slide that we just looked at, that how they determines the pay for your premium for each month. So if you worked over 40 hours or not, if you have not worked 40 hours, you may purchase Part A. You can also choose to sign up for Part B, Medicare insurance. Part B helps pay for services from doctors and other healthcare providers, outpatient care, home health care, and durable medical equipment, and some preventative services. Okay. So again, Social Security covers original Medicare, which is Part A and Part B, and we're going to go a little deeper into that in a minute. So let's go through the different parts of Part D. I mean, a part of Medicare. There are four parts. And let's start from the beginning. Of course, there's Part A. We just discussed Part A and B, which is part of the original Medicare that Social Security helps cover. And then there is the Part C and Part D. Part D is your prescription drug plan that is not included in the original Medicare. Keep that in mind. I'm going to say that multiple times throughout um, this presentation. Part C is your 3-in-1, kind of like Purpose DNA and Health. It covers Part A, B, and Part D, which is your prescription drug plan. Okay. You want to keep this in mind. Part C is your 3-in-1, A, B, and D. Okay. A and B is your original Medicare. Keep that in mind. Does not include prescription drug care. Okay, so Part A and Part B is your original Medicare, like I said before. Part A covers the hospital care, and then medical care is your Part B. So if you need to see your doctor and you have appointments, that would be your medical Part B. Also, keep in mind that Part A and Part B, they are provided by the federal government, which is your Social Security, which is why you get Social Security. Original Medicare is for people 65 and older, those under 65 and those under 65 with certain disabilities. Remember, we talked about the renal failure as well as the ALS. Um, Now, Part C and Part D, which is Medicare Advantage and your prescription drug plan. Part C, Medicare Advantage, is your 3-in-1, remember? You can buy Part C from private insurance companies. Medicare Advantage combines Part A and B and often offers prescription drug coverage. It may include additional benefits like dental, vision, hearing, and wellness. So there are some other perks to Part C besides it all being a 3-in-1 as well. So that's always a great perk. Part D is usually you can purchase it as a standalone prescription drug plan. This is something that will most likely happen if you want to stay with the original Medicare, but you do need a prescription drug plan, then you will add that on to it. You can enroll in it with Parts A and or Part B, but you must live in planned service areas in order to get Part D as well. Now, you can rely on Part A and Part B but original Medicare has deductibles and only covers about 80% of your Part B services, okay? It covers hospital and doctor visits along with certain limited medications. It does not include prescription drug plans, okay? Keep that in mind. It does not include prescription drug plans. You will also be responsible for 20% that the original Medicare deductible does not cover. But I'm going to go a little deeper into this in just a second as well. We have a way to offset that. When you choose Medicare Advantage Part C, the plan will cover, of course, the original Medicare, which is Part A and Part B, all the same benefits as original Medicare. You may also include benefits original Medicare does not cover, like the dental, vision, and hearing, and the prescription drug with most plans. So with most plans, you will be able to include the dental, vision, and hearing for the Medicare Advantage as well as the prescription drug plan, which is why most people try to lean towards these plans. Part C also has a yearly limited out-of-pocket cost for covered medical services, unlike original Medicare. Okay, so Medicare has the deductible. Original Medicare has the deductible, and then Part C has out-of-pocket costs. How Part D works. You can buy this in addition to Part A and Part B, but you do not have, if you do not have other credible coverage. So if you don't have any other coverage, you can Part D. If you have Part A and or D, Part B. Let me say that, slow that down a little bit. You can buy this Part D with Part A and B if you do not have credible coverage. So you can buy Part D as a standalone prescription drug, or you can do the 3-in-1, which it usually includes with coverage for Part D. So we're going to go a little deeper into the prescription drug coverage. There are different phases in it, and phase one is your deductible. Until you have reached your deductible, you'll pay the full discounted cost for your coverage drug. Some plans have a zero deductible. And I also want you to keep in mind that every plan has a different deductible. So when you see these numbers over here, this may not be the same deductible, same amount for each plan. So I'm just using these numbers as an example. Your initial coverage, which is phase two, after you have reached your deductible, you'll pay only part of the cost for your covered drugs. Remember, we're talking about the deductible here, okay? After you and your plan have paid a total of 5,300, you'll pay only part of the cost for your coverage drugs until you reach the 8,000. So again, keep in mind, every plan is different. These numbers may not be the same, but in phase three, you and your plan have paid a certain amount, and then you'll only pay part of the cost until you reach this. Not a catastrophic coverage. This is when you have reached, you both, your plan and yourself, have reached this total for the deductible. And you're out of the coverage gap now. So you'll pay zero for covered drugs for the rest of the year once you've reached this phase. So let's go into what your options are here, okay? You can choose two paths. You have, of course, the original Medicare, which is Part A and Part B. With the original Medicare, if you do need a prescription drug plan, you have to buy it separately, and or you'll be able to buy a supplemental plan, which we like to call the GAP plan, that will help you cover the 20% of your out-of-pocket costs or any other fees that you may have. Also, there is your second path, which is Medicare Advantage combined. Of course, that's the 3-in-1. Most people like this one. You can get your Part A and B as well as your Part D. If your plan does not include it, you may be able to join a separate plan for Part D. Okay? Now, let's keep it moving to the next slide. When you do choose the Medicare Advantage, you have two options. You can do an HMO or you can do a PPO. HMO stands for Health Maintenance Organization. That means that you will have to use doctors inside the network, and you may need a referral to see a specialist if you need to see a heart specialist or a kidney specialist or any type of specialist for that matter. You will need to possibly get a referral for that. Now, if you decide to get a PPO, which is Preferred Provider Organization, you can use doctors and hospitals outside of the network, but you often have a higher share cost. So you have to pay a little bit more, which will come in your premium for that PPO plan. All right. What cost does Medicare Advantage cover? Now, remember, these prices vary depending on plans. Okay. Now, Part A will pay $1,632 for deductible hospital insurance. Okay. This is for Part A. 204 per day when we talk about the co-insurance skilled nursing facility, up to 21 days through 100 days, they will pay $204 a day. For Part B, your annual deductible insurance is $240. This is your deductible. And then there's a 20% co-insurance for doctor services that the plan covers, okay? Um, Now, there are always perks. Everybody likes perks. I like perks. You like perks. Everybody get perks. Medicare Advantage has perks, okay? So it may include, your plan may include, most plans include dental, vision, and hearing, okay? So you'll be able to get your dental, your annual hearing exams and hearing aids, and then annual vision exams and eyewear. You also get Part D prescription drugs, emergency medical care outside of the USA, and some over-the-counter benefit items, okay? Which is always good. So now we're going to go a little bit deeper into DSNP. DSNP is Dual Eligible Special Needs Plan. This plan specializes Medicare Advantage plans created for those who qualify for both Medicare and Medicaid. So if you have Medicare and Medicaid, this is a plan that you might want to try to look into. You must have a state Medicaid plan and qualify for Medicare Advantage plan to be able to get a DSNP. A lot of people like DSNP. They have some great perks as well. I've come to see. So how do DSNP works? With DSNP, I want you to keep this in mind. This is the important note. Medicare is your primary payer for medical service, while Medicaid is the secondary payer. This means Medicare is the first to pay for covered medical services. When Medicaid pays for the remaining qualified costs, some members will have remaining out-of-pocket costs. Not everybody, but some of them. Okay, keep that in mind. Medicare is your primary, which is going to be paid first, and then Medicaid covers what's left, or some or most of what's left, right? Okay, so why should you consider a DSNP? Of course, there are perks. Everybody like perks, okay? Much like a traditional Medicare Advantage plan, a DSNP can include additional benefits that original Medicare and Medicaid alone may not cover. These may include dental care, eye exam, what most people I've learned to like, see and like are transportation to doctor's appointments, a personal care team, and over-the-counter benefits and wellness items. So let's say you have like my mom, she wasn't always able to get to her doctor's appointment if I had to work, or if it was you're just not able to take your loved one to the doctor's appointment. If they have a plan with the transportation to doctor's appointments inside of it, that'll help cover the cost to get her to her doctor. So you don't have to worry about that. That's one of the great perks about a DSNP, okay? So we're almost done. We are almost about to wrap up. We are about to bring it all together, okay? So let's get to the steps. First, enroll in Medicare Part A, Part B. When you first are eligible, do not wait. I'll tell you why in just a minute, all right? And then You now have two ways to proceed. Of course, we've talked about them, but we're going to bring them back again. Keep original Medicaid, not Medicaid, keep original Medicare and add a supplemental insurance, which is the Medigap or Medicare Part D. The Medigap helps cover the 20% that you would be responsible for out of pocket. Okay? And then you can buy Medicare Advantage plan. This combines Medicare Part A, Part B, and often Part D and additional benefits. Those are your two ways to proceed, all righty? So now we're going to jump into a couple frequently asked questions, and then I will let you guys have a wonderful day. Okay. How do I enroll in Medicare Part A and Part B? It is simple. If you're getting Social Security when you turn 65, you'll automatically be enrolled. If not, you need to sign up with Part A and Part B. Contact Social Security 3 months before you turn 65. You don't want to wait, okay? And if you worked for the railroad, contact the railroad retirement board. People on Social Security disability, listen up. You will automatically be enrolled in your 25th month of disability. So if you've been on disability, once you reach your 25th month, you will automatically be enrolled. But keep in mind, you will only be enrolled in the original Medicare. You want to get with a agent, or you can contact me. I can help you to get those extra perks, to get that supplemental, or to get the Part D, or to just get enrolled into a Medicare Advantage plan, okay? Frequently asked question number two. When can I enroll in Part A and Part B? You can enroll the same thing 3 months before you turn 65, your birthday month, the 3 months after the month you turn 65. If you don't enroll in that window, what happens if you don't enroll in that window? You may have to pay a penalty in the form of higher premium. So that means your premium will go up because you waited and didn't enroll when you were eligible. Okay, so I say go ahead and do it, even if you don't necessarily need it right now because you're still working or something. Go ahead and enroll. When can I enroll in Medicare Part C and D? During the same 7 month window as Part B. That means during the same 3 months before you turn 65, your birthday month, in 3 months after the month you turn 65. Now, that is pretty much my presentation. I hope I didn't keep you too long. If you have any questions, you need a one-on-one with me, go ahead and call me or text me at that phone number. Well, depending on what time it is, I say send me a text message first to this phone number. Um, this is the replay. So if you if you did this, you may have registered with me to get this replay, and you might have just seen it. But if you do register on there, there's a form that says they ask you if you would like to be contacted for a one-on-one. So you can pick option one or two for that. But either way, you're welcome to just text me. And if you did say yes to the registration with me contacting you, then I will be contacting you. If you have any questions, remember I am located in Greenville, South Carolina. I am a licensed insurance agent, and I will be happy to assist you in any way. Even if you have any questions, you don't quite understand something, I'm totally happy to help any way that I can in that area. Okay. So that is my presentation, and I hope you enjoyed it. Thank you for being with me at this time. I am going to let you guys have a wonderful day. Be blessed.